this is a breakdown of how our system currently works. If you understand how it's broken, then now we can begin meaningful dialogue about how to fix it. Again, without trying to criminalize doctors, because I think a lot of people look at their doctors, especially after the last many years, and there's a distrust, a tremendous distrust out there for patients between doctors and hospitals. And rightly so. I think there have been some things that have happened that have created that distrust, but I don't think I don't think all doctors are bad by any stretch. So this triangle represents the current state of medicine. So you have the patient at the core, you have doctors as part of the outer ring of this triangle. You have Big Pharma / Agra, so this is agriculture and pharma because they're basically owned by the same companies. And then this final wall of the triangle is government. And so if we look at, again, this is the state of healthcare. Let me describe it. So the government makes policies that influence patient decisions. Doctors have procedures in hospitals. We could say doctors in hospitals have procedures or standards of care that influence patient decision making. And then Big Pharma, advertise directly to the consumer. Their ads are the #1 revenue resource for news media in the United States. And so they have a tremendous influence on patient behavior and patient choices. That's why they throw so much money at advertising dollars, because Big Pharma knows that they're going to influence patient decision making as a result of being in front of them nonstop on news channels. So you've got these three main driving forces influencing patient decision making, right? Because patients, at the end of the day, patients aren't doctors. The average person is not a doctor and doesn't know physiology or anatomy, etc., and they're not really versed in these things, and so they have to rely on predominantly these three influences to be able to try to come to intelligent decisions, right? So if we're saying these three influence patient decisions. Because at the end of the day, it's very important that you understand that what the government, what pharma, and what doctors say are all just feedback for you to assess intelligently so that you can make the best decision possible for yourself. And that none of these agencies or industries should be making the decision for you. You should never outsource your healthcare decisions to these groups. You should always be the one making the final determinant decision based on as much information as you can gather and collect about your situation. But unfortunately, what we have here, so if we got the government, we've got Big Pharma, and we've got doctors and hospitals. One of the things that's happened in this arena with doctors and hospitals is it's been corporatized. Meaning that big publicly traded companies have come in and they've bought out private practices and they've bought out hospital systems and they've instilled standards that are not designed to improve patient outcomes. These standards are designed to increase revenue. Why are corporations in business? Predominantly, they're in business to drive profits and to have return on investment. And this is one of the conflicts when you allow a corporatization of doctors and hospitals. It's very, very hard nowadays to find doctors who are actually in a private practice and where that practice is owned by the doctor and not owned by a massive corporation that, again, creates standards with the primary driver of increasing revenue. And I'm not saying that all corporatized hospital systems don't care about patient outcomes, but what I'm saying is they're prioritizing increasing revenue over patient outcomes. And that's very clear and obvious based on the facts and statistics I've already shown you. We spend $4.7 trillion a year, and medicine is the third leading cause of death. We definitely have a flaw and a breakdown in our system. Now, beyond that, we have, Big Pharma and Big Agri. So Big Agri grows the food. We could call it food. Let's not call it food. Let's call it food, because Frankenfood, because the food itself isn't really technically food. It's a lot of things that have had genetic manipulation, and that there is a tremendous amount of chemicals that get added to our food or sprayed directly on our food. These are chemicals that the applicators, the farmers themselves that are applying the chemicals, are wearing gas masks and protective wear to prevent themselves from being injured by the chemicals they're spraying on our food that we're going to be eating and that we're going to be feeding our children, right? And so you get genetically modified organisms, you get chemicals that are being added, and then when that food goes to factories, which are owned by corporations, you now process that food, stripping away more of its nutritional value, adding flavor agents, adding texturizing agents, adding palatability agents, adding chemicals like caffeine to increase addictability of junk food, etc. So you have Agri that's responsible for doing this, right? But then you have Agri also communicates and pays doctors to say that this is safe, right? So there's a kind of a coordination between the doctors, and it's not always just medical doctors either. Doctors could also be PhDs, doctors that have higher level degrees in science that are basically paid shills to say, yeah, this stuff is safe. It's not killing people immediately when they eat it. And so therefore, everyone should eat it and it's safe for everyone. Even though as we look at processed food and we look at food grown with these chemicals over the past, really since the early 1990s, we look at the tremendous trajectory of diseases and expenditure on diseases. Again, diseases that we could otherwise prevent as a result of these behaviors. So we've got big Agri paying doctors to talk about how safe their chemically loaded foods are, because they're also owned by these similar corporations that their priorities are revenue, not outcomes, not outcomes of health. And then you have Big Pharma as well. When we know the industry is influenced by Big Pharma tremendously, we know, and there have been a number of research studies and publications showing this actually to be fact, that pharma spends a lot of money in doctors' offices and in hospitals influencing decision-making of how drug prescriptions and treatments are rendered. We also know that Big Pharma and Big Agri have a relationship with government. And this relationship can be very easily seen at the CDC directly. The CDC, a lot of the directors of the CDC, when they're done working for the government, are hired by Big Pharma and given these big, cushy, multi-million-dollar paycheck jobs after working for the government, and vice versa. Some of the people that run big pharmacy companies actually go into the government and start working for the government. Well, the point of the government is to regulate Big Pharma, right? That's the purpose, is to regulate business from taking advantage of consumers to make sure that these things are safe. But what's happened is there's a communication, if you will, between government and Big Pharma, or a relationship that doesn't put the patient first. It puts profits first. And so there's what we would call regulatory capture. The very government that we have elected to protect us from things that can go wrong here is actually been infiltrated by this industry. And so the people in the government that run that agency are really just, it's a revolving door between these two entities. And so we get manipulation, we get lies, we get misinformation and disinformation, And we get policies around health that aren't very helpful and can end up harming the patient. And again, all of these industries are influencing the patient's ability to make a decision. Because when you have the government in bed with Big Pharma and Big Agri, and you have Big Pharma over-influencing autonomous doctor decision-making, and you have the same corporations that own a lot of this are now buying out the hospitals. The purpose here, what I'm trying to get at, is you have this massive complex of a system that's been monopolized. Basically you have a monopoly, a healthcare monopoly, where everyone's doing it wrong. The outcomes are horrible, but the cost and the expense is extremely profitable. And who's winning? When the profits are this high, well, these guys are huge winners. These guys are huge winners because they've been corporatized and they've been bought out. And so again, they're prioritizing revenue. And even the government is a big winner. And the government's a big winner because they're getting paid as well. There's tremendous amount of revenue that goes into the government agencies that are supposed to regulate and control bad behaviors of these companies. But the number one source of revenue to the government regulatory agencies actually comes from the agencies, or from the companies that they're supposed to regulate. So we have this really backward system where there's a coercion or manipulation amongst these three groups influencing patient decisions. And the average person that's sitting in the middle of all this, they think, oh, the government, they're regulating things, they're doing it right. There's just no way that we're paying this big, huge government industries or entities like the CDC and the FDA, and they're doing it wrong. Big Pharma is for all intents and purposes not evil. They can't possibly be evil. They're out there trying to make medicines that save lives. And of course, doctors aren't evil. They're out there trying to use those medicines to save lives. And I would agree that this should be what the patient should think. In an ideal world where profit wasn't the primary motive, it would be an accurate way to go about looking at this. But the reality is, it's not how it is. But the patients typically don't know better. So they're making decisions from feedback from government entities that are being paid by pharma, and from doctors that are also being influenced by pharma, and medical schools are being influenced by pharma. So it's just a big circle of frustration, because when you're trying to make the decision from this undue influence, it's hard to come to the truth. And this is where I found myself when I was advocating for a family member in the hospital, was that how do I get to the truth when the doctor won't do a proper exam, and the doctor won't have proper communication, and the doctor is not doing their job, but it's not necessarily even that it's the doctor, it's the hospital policy, right? And that's all been influenced here. But it's also been influenced by government agencies, because government produces regulatory boards that control, to a large extent, the behavior of these organizations. And so government, in my opinion, is not really doing a fantastic job, because we have all these statistics. As I've shown you, the U.S. ranks 60th in life expectancy. The third leading cause of death in the U.S. is medical treatment. Not improper treatment, just treatment, because it's the standard of care. We spend $378 billion in the U.S. on prescriptions alone, but ultimately this whole thing costs $4.7 trillion. So this is a $4.7 trillion industry that is the third leading cause of death, and we're ranked 60th in life expectancy. And if you can't see that that's a problem, I don't know